Excellence, Madame la Présidente de l'OPTAD, Madame ma chère sœur Antoinette Sassou Nguesso, Excellencies, dear sisters, mes chères sœurs, Excellence Hinda Déby Itno, Première Dame de la République du Tchad, Excellence Aïssata Issoufou, Première Dame de la République du Niger, Excellency Rebecca Akufo-Addo, First Lady of the Republic of Ghana, Excellency Neo Jane Masisi, First Lady of the Republic of Botswana, distinguished partners, esteemed ladies and gentlemen, bonjour, good morning. Permettez-moi tout d'abord d'exprimer au nom des communautés, des communautés et en mon nom personnel combien il m'est très agréable de commencer cette semaine avec vous. Votre présence honore ce panel autour de la question du leadership des Premières Dames d'Afrique dans la lutte contre le VIH-Sida et pouvoir organiser cette 20e conférence internationale sur le sida et les infections sexuellement transmissibles en Afrique, ICASA, est un honneur pour le Rwanda du fait de notre engagement de longue date dans ce combat contre le sida, mais aussi de voir réunis chez nous tant de personnes déterminées à résoudre ce grand défi de notre époque. Je vous souhaite donc la bienvenue à Kigali et vous invite à prendre le temps, en dehors de cette conférence, de visiter et de profiter de ce que notre pays des mille collines a à vous offrir. Distinguished guests, OAFLA was born 17 years ago out of our collective need to amplify the voices of those living with and affected by HIV and AIDS, especially the most vulnerable, among them women and children. At the time, the urgency of the situation in most of our countries demanded that each of us prioritize programs and projects that were suited to the needs of the most disadvantaged families that were affected. And as we gain more ground in the fight against HIV and AIDS, the strategies and scope of our organization as a whole have understandably evolved, reflecting a deeper understanding and appreciation of our reach as First Ladies. Dear sisters, distinguished partners, as we gather here today, there is a good cause for us to celebrate the impact of our joint efforts and continuous commitment. We can all attest to the difference that initiatives such as the Free to Shine campaign have made in each one of our countries, pushing us to strengthen our efforts and commitment to end pediatric AIDS and keep mothers healthy. At my foundation in Buto, we have also focused on designing and implementing projects which align with the national and international priorities set at a macro level, such as Rwanda's strategy for transformation, the Agenda 2063 of the AU, and the SDGs. Projects such as Family Package, born to address pressing PMTCT needs 18 years ago, offers a comprehensive package of services to families affected by HIV and AIDS, as well as teenage mothers. Through this project, HIV-positive families are linked to health centers, and adherence to ART treatment is ensured through the follow-up of a network of community health workers and peer educators. And thanks to the nationwide efforts, current PMTCT coverage have now reached 96%. Our adolescent sexual reproductive health projects, promoting access to information, quality treatment, and services for the youth to decrease new HIV infections among young people in both urban and rural areas since 2010, also contribute to our national and the continental fight against HIV and AIDS and STIs. Indeed, concerted efforts between public and private stakeholders have resulted in notable progress toward ending AIDS at different levels. In Rwanda, as of 2018, new HIV infections have decreased by 83%, and AIDS-related death had dropped by 82% in the last 20 years. distinguished guests, celebrating our gains should also give way to a deep analysis of our journey thus far. It should be an opportunity for us to have genuine and open conversations about the diverse challenges, including those resulting from gender inequality, that despite our efforts keep holding the African continent back in terms of effectively responding and preventing HIV and AIDS among our people. It should be a chance for us to exchange ideas on possible solutions to achieve our demographic dividend. My dear sisters, as we reflect on our multifaceted roles in this journey to ensure that our communities fully thrive, let us acknowledge what has worked and reveal what has not. This, I believe, will enable us to make more meaningful interventions. Distingués invités, pour conclure, permettez-moi de vous remercier de nouveau de vous être joints à nous pour cette conférence d'ICASA, qui, je le crois, nous rapproche encore plus de notre objectif de mettre fin à cette épidémie que le VIH-Sida. Je vous remercie de votre attention.